This is a Genubender. We use this a lot for our knee patients in order to help them get some extension and some flexion back into that knee following a surgery or injury. So Abby, go ahead and hop up on there for me. So with the Genubender, we want to make sure that this backrest is in a good spot as well. So we want to make sure that her knee is going to be right on that edge. So you're going to be curling around that side of the table. Is this in a good spot for you?
It could go back a little bit.
Okay. You want to release this latch right here. It will slide back and you can just push it down just like that and it will lock into place. Is that a good spot for you?
That sounds great.
Awesome. Now we want to make sure that this is also lined up with that leg. So you can come down here and this slides side to side, right, just like this. Make sure that's lined up right there. You're gonna pop this up here and you'll have the patient crank that up. So Abby, go ahead and crank that up for me. You wanna make sure this part is sitting right on her ankle. There's always gonna be a little towel floating around here. You wanna pop that right on their ankle and then you can buckle that over and make sure that's nice and tight. That way that strap doesn't rub on their skin. The last strap is gonna be right here and you wanna buckle that over that thigh. This just keeps that hip down so that they're getting a better stretch and that extension and flexion when they're cranking it for themselves. So now we're gonna have this part of the bender. This part will track the degrees that they get versus our on flexion and extension. So there's a little search bar on this screen that you can search for patients. It'll be the patient's first name and the first 2 letters of their last name. But you can also add a new patient right here. So after you've clicked add new patient, you'll see the screen that says first name and last name, and you'll be able to put in a first name and the first 2 initials of their last name. You click save. It will save. And then you hit this button right here that says start new session. When you start new session, generally we'll do 10 minutes. You'll change that to 10 minutes, use the timer. You'll hit start session and the patient can then crank up their knee into both extension like this and deflection. And then when they get to as far as they can crank it, they'll hold that for 10 seconds and the bender will actually count for them. This number will turn green when it hits 10 seconds. And then they know that they can crank it back up to that opposite direction, in this case extension. And that way they're getting a little bit of a stretch in both directions either way.